Kidney disease is among the leading causes of deaths in the Philippines. In the latest report from the World Health Organization, kidney disease ranked 9th in the top 50 causes of death in the country in 2010, as it claimed nearly 13,000 lives. One of the most common approaches towards treatment of advanced and permanent kidney failure is hemodialysis. Hemodialysis is performed to remove waste products such as creatinine and urea and free water from the blood when the kidneys are in a state of renal failure. Hemodialysis is long-term and relatively expensive. Patients need to undertake the procedure at least 2 times a week or more than 100 sessions in a year, with hospitals and hemodialysis centers charging roughly 8,000 pesos per session. A renal patient needs to spend 16,000 pesos a week, or 832,000 pesos a year, which is way beyond the average income of Filipino. In response to the great demand for high-quality and affordable hemodialysis services, the Nephro Group was established to pioneer outpatient dialysis in the Philippines.
I visited Philippines in 1995 with my partner, Paul Hojico. And we visited some major medical center, the dialysis center of the hospital. And I spoke with the nephrologist also. And I find out the technology, the service, the patient care may need some substantial improvement.
Probably the first reason is we had the right combination of partners with the right set of skills to really be able to bring cost savings while providing high-quality hemodialysis services in the Philippines. One of my partners is a nephrologist. One has experience in the technical and negotiating areas, and I myself have for many years run quite a number of dialysis centers, so I have the operational experience.
Since establishing its first dialysis center in 1996, the Nephro Group has reached out to tens of thousands of renal patients through its other centers spread across the country.
I believe in what the company's mission and vision is, to take care of the sick, giving them quality dialysis at an affordable cost. We make sure that we make their lives better even on dialysis. Not just the patient themselves, also the family.
The Nephro Group introduced several pioneering processes in the Philippines. Open unit concept in patient referral, the packaging of medication, laboratory, and dialyzer for PhilHealth and HMO patients.
Hindi lang talaga sila sa karamdaman ko lang na, kundi binibigyan din nila ako ng kami, mga pasyente, ng parang moral support na which is good para sa amin, para hindi na kami maka-feel na kawawa kami.
We'll find ways that our patients can continue because it's a lifetime treatment. So one of the problems here in the Philippines is really financial. So good that we have the assistance from the government incorporated with our packages. So we have packages that even on the first months, they don't pay anything.
The Nephro Group, together with its subsidiary, the Nephro Synergies, is currently the biggest network of dialysis facilities in the country. Since 2010, it is fastly expanding, not only in Luzon, but also in Visayas and Mindanao. By first or second quarter of 2015, it will be operating 34 dialysis facilities, 23 in Luzon, 3 in Visayas, and 8 in Mindanao. Additional areas have been identified for a continuing expansion.
With Nephro Synergies, we partner with hospitals. We provide everything, collection from PhilHealth and other government agencies, including the design of the unit, the dialysates, employees, everything. So it's a one-stop shop kind of thing.
Each and every center is equipped with modern dialysis machines and US FDA-approved medical supplies, and are manned by highly trained medical professionals.
I can see very tangible evidence in my patients nowadays. They have higher survival, and I can be able to convince them easily to start dialysis treatment. Unlike before that, they only design if they are dying already.
Started my dialysis on May 31, 2011. Para kayong kapamilya ng isa, no? Sa loob, malaking tulong yung Nefro sa akin kasi siya nang nagdudugtong ng buhay.
The Nephro Group takes pride in the fact that even with these innovations, its rates are not only among the lowest in the world, but are indeed affordable to average renal patients. Further separating Nephro Group from other dialysis centers is the fact that all of its centers are independently run and are not at the mercy of suppliers. Everything in the supply chain is integrated, including a modern training center that was established to ensure a steady pool of highly skilled and patient-oriented dialysis nurses. Consistent with the rationale behind the Nephro Group, Nefro Global was established to develop the most advanced and highly specialized dialysis training program. It offers training programs in the renal care industry that are holistic in nature, where technical proficiency is a minimum requirement.
We've actually been training for the past 16 years, but now we formalized it. We give out certificates. We got accredited by RENAP, and we have branches in Mandaluyong, in Cebu, in Santa Mesa, in Cagayan de Oro, and in Davao. So we've been training nurses to be really well versed with dialysis care.
I trained at Nephro Global for 5 months. I learned not only theories but also practical skills. After the training, I was hired right away by the Nephro Group. I am confident that I can give proper hemodialysis treatment to patients.
I am very satisfied with my formal training at Nephro Global. We gain experience on actual renal care. I highly recommend Global Nephro to aspiring dialysis nurses.
I can say that the Nephro Global graduates are not only locally but also globally competitive.
At the end of each training, we offer a free review class so that we have to be sure that we pass the REDEP exam.
Almost 2 decades since its establishment, the Nephro Group has gone a long way in redefining the dialysis industry in the Philippines. It has set a definitive benchmark on how renal centers should be run and how patients should be cared for. Over 1 million renal patients have come to understand and embrace the fact that through an excellent patient-doctor relation, sustained hemodialysis treatment, proper diet, and positive disposition, a kidney patient can live a lengthy and productive life.